We're going down. So, my dear, we slow dancing. I was the one you always dreamed of. You were the one I tried to draw. How dare you say it's nothing to me? Baby, you're the only light I ever saw. I made the most of all the sadness. You'll be a bitch because you can. You try to hit me just to hit me, so you leave me feeling dirty because you can't understand. We're going down. We're going down. My dear, we're slow dancing. Don't cry about it, why don't you? Don't cry about it, why don't you? Slow dancing.
All right. All right. Hang on, Amy. Something's about.
I'm the boy
Oh, there we
you
go.
ever phone, lighting up inside.
Jeez, oh Pete. Sorry. All right. I went to like full screen mode.
Mm.
Okay. And then I was like, I don't know where I'm at. All right. How are you, kid?
Good, how are you?
Good, good. Weekend was good?
Yep.
Right. I know. We had some fun. Friday night was good.
Yeah, that was good.
Office manager, 20 years. 20,
20 years. Crazy.
20 years. Can't even believe it. Can't even believe I put up with her for that long.
Or the other way around.
Or the other way around. Yeah, that's true. That's very true. But yeah, so tonight is going to be interesting because one of our favorites at our office got us thinking about this, and Miss Teresa Beach, she's one of the smiling fronts of the whole thing, and me and her got excited. Um, but we're also going to make it into some of these because I didn't think about it. Once we go through all the herbs of anti-inflammatory, all the herbs of all those, how do you work together with them? So we're going to go through, and then probably the next bunch of weeks will be different things. Like this week is what happens and how do you approach it herbally, holistically, with all the knowledge you've currently have on anti-inflammatory, muscle relaxer, those kind of things. So we're going to go through that with each one. So we're going to do this week is acute. Like say you hurt your back, hurt a knee, hurt something acutely, which means like bam, hit it hard. Um, Not much, and then the next time we do this, it'll be like more of the chronic or those chronic pains and those kind of things, and kind of like where you'd start, right? So it can be overwhelming just Googling all this information, and like a lot of people bring me some really good herbs, now that it's there, which is really cool, like watching people like improve their stuff, like as we go. I want to hear all those. But for me, what we're going to go through tonight is what we want to start with. Okay. So that's basically it. So here is my little stuff we study or I found this week. So I'll read this real quick. So, we're going back to that thing. We're going to have one of those too. Where do you start with gut bacteria, right? So we'll have that whole process as well. But this first one is the gut microbiome is the key to understanding which diet or which approach of food will be the best for you. Oh, sorry. My corgi decided to open the door with her nose. That is fantastic. So that could be a key to understanding like how you're going to go. If you have a terrible gut bacteria, then you might have to do a more restrictive type situation. There are a lot of different approaches right now that a lot of people are discovering. Intermittent fasting, that's been around for a long time, honestly. But it's sometimes it works good, and sometimes that's the better move if your gut bacteria is terrible, right? So there's a lot of little key pieces to understanding that. So make sure you know what your gut's doing prior to taking on something, right? Because there's a lot of medical pills out there, making sure you stay as healthy as you can while you're doing that. So that's that. Sleeping problems, this was kind of a study. um Man, there's so many that you could do other than just doing the same thing over and over and hoping for a different result in sleeping. So one of my favorites, so I'll give you four different ones. One is meditate. So instead of going to bed, find a way, get some headphones, get something to just meditate. Use that time to allow yourself to go into a different space. A lot of times you'll fall asleep at that point. But you never know. Like it could be you don't, right? But at least you're being productive in that part. Like we've talked before, visualizing, meditation, all those things are really, really good. So that's a good habit to get into, especially if you have difficulty. Get out of bed. Get out of bed is a good one. Instead of tossing and turning, you get out of bed and physically change your environment and just move. Just make sure the loved one's not like thinking you're mad at them or something. But that is one thing to look at. Look at your bed, your actual mattress. Make sure it's like they tell you 20 years. Most of the time after 10, you're pretty much toast, especially if you got like dogs and kids and all that other stuff. Think about how many actual humans or animals or whatever are sleeping in your bed, and that will eat the life of your bed. So just remember that, thinking, just make sure you do, like, you might, if you sleep better in a hotel, easily, like sometimes maybe it's time to reevaluate that mattress situation. So the other one is get more sun, because the get more sun, vitamin D. Today was tricky in Michigan, gorgeous, freezing.
Yeah.
So I was a little late on this because I was trying to put our chicken run together. Oh, I thought all PVC pipe would be perfect.
Mm,
Not so much.
nope.
So I got a little more work to do, but I thought I'd have it done. So it's a pretty good one. If it gets all done, I gotta get all the parts right. So so anyway, that is pretty good. Decreasing sugar before to go to bed is kind of an obvious one, right? So that is a key one. And then the last thing this week was that ashwagandha is not just good for your overall every organ, but it also can help with cognition. So your brain health is a big one on that. All right. All right.
Cool.
Let's do this. Okay, so let's go to, because I had so much good luck. Oh, might have figured this out. All right, here we go. All right, before I start, I'm going to shut that door. So if my wife is watching something, that's it. I mean, the only thing on is 1% Tribe on 8 o'clock on Sunday night. So I don't know what she would. So this is 1% Tribe, acute pain, and how to treat it holistically. Okay, so we're going to go through a few things. An understanding of what is occurring in an acute injury, which is a big piece of tonight, um, and a strategy you can do for the acute injury to start the healing process. Okay, and then of course, the herbs tonight is going to be our key, what we're going to talk about. So herbs you can use to help you in the holistic way. So let's start talking about that. What is happening in an acute injury? So an acute injury, it's all, we hurt the same stuff, right? But it's just in a different way. So usually people think that they hurt muscle, which muscle is actually the probably the least of the things that get injured, right? Most of the time, it's the ligaments, the tendons, what they call, I should have put that on there, fascia. Fascia is kind of a mix. I like telling people it's kind of a mix between ligament and muscle. It's kind of like where those two things interact and they start changing and they mix together there. So you hurt, like you fall on your knee and it starts to swell. These are all pieces of what's actually occurring. So when that inflammation comes, it's ligament, muscle, the cells of your body start interacting. That's why the inflammation comes, and the bone a little bit. So that's one of those. Let's say you hurt your low back. Okay. A lot of people think they pull a muscle. That's the least of the concerns in any kind of acute situation. So you pick something up and you feel something, right? And you can't move very well. Those are situations that are probably not muscle per se. They're cells starting to interact. If it was just a muscle, you could stop moving and it would, like maybe chill out a little bit. But with a true acute injury, you have inflammation. That inflammation goes into the ligaments, the muscle, the cells in the bone most of the time, and the fascia most of the time. Ligament injury is where it kind of begins. That's why twisting wrong when it's a low back injury or something of that nature. I always think this time of year, especially, we start throwing things around we shouldn't, or in bad ways, different directions, come up with a lot of acute injuries at that time. So, so those are things just to keep in mind as we go forward so that we understand what's happening, right? You don't just, these acute injuries occur, they're there. You had something happen to you. How do you treat it? Okay. All right. So, what I want to explain. So, this is just these cool pictures of inflammation right now, but in the inflammation process, what happens is when you have these cells, you have more cells than normal coming into an area. Okay. So, an injury occurs. Some of the ligament gets torn, or the muscle gets a little irritated, those kind of things. So once that occurs, the inflammation, these cells come in and they start coming in as more of the issue, right? So as those inflammation cells start coming in, you have more and more of them. That's why it actually causes this increase in cells, okay, in that area. The reason I bring it up is because this is the way a holistic is different than typical oh situations there. So what'll happen is when that inflammation comes in, it's going to increase the joint space in between whatever the joint is we're talking about. Could be any of them. When that increase in joint space comes in, then you start getting what you would call, we would all have these muscle reactions. So this muscle reaction is to press and hold that joint space as close together as possible, with that inflammation still being able to do it. That's where you get what they call guarding. So if you tick off let's say a disc of your low back, it inflames, the muscles around it freak out to make sure that you're not going to do anything that will cause more inflammation in that area. So it starts to lock it down. So that's kind of the approach I want you to always have in your head, when you have an injury like that. Because 99 out of 100 times, if somebody goes to an urgent care, ER, they give the worst advice possible to an acute injury, and that is heat it. It's the worst. Like, don't do that first ever, right? And the reason is because it's usually an inflammation process. They don't know what you actually did, to that joint, and we have to let it relax. Now, is heat an evil empire? No, it's just not the first thing we need to do, because now we have all these cells kind of coming into this one area to kind of control and calm this down. All right. Does that make sense? All right, good. All right, so let's go to the next one. So, when you have an acute injury, what should you do? So, one of the best things that you learn in pretty much everything, physical therapy to if you're a first responder, you rice it. Okay. So it's I always remember it because I'm old, is rice. I think it's a new one now. There might be added another thing on there. But it's when I was taking it, it was rest ice. So you rest the area, you get pressure off of the area, you ice it, you compress it, so you put stuff on it to make sure it's good, and then you elevate as best you can. So it's rest ice. So it's an easy way to remember it is rice, right? So rest, ice, compression, elevation. All right. So if the time is available and you're able to do this, I personally, as a chiropractor, would make sure that my joints of wherever I injured are working properly at the time. So if it's available at the time, try to get a chiropractic adjustment or evaluation to make sure everything is good, because it's critical to make sure that if the bone of the joint is in play and that mechanics isn't working, that leads to the next step where there's constantly going to be inflammation coming in there with two joints that aren't working. Okay. Hopefully that makes sense. The next part of this one in the acute injury is movement as much as possible. So one of the biggest things is keep moving. Like that is a big key to the whole thing. A lot of times with low back, you can drop the severity of a low back condition simply by icing it and then moving. You can get it down to about 20 to 30% of the time. It's less than what it was when it began. So a lot of times, especially in the severe ones where, I mean, we all know, like we've seen back problems that go to, oh man, you're on crutches, you're walkers, those kind of things. You can get it that severe. The biggest thing is like understanding that movement is going to be a big deal for you, is going to be one of the key aspects to things. Okay. Now we can start talking about herbals and how to approach it in an herbal way. Okay. So if you ever had to go to an urgent care, ER, those kind of situations, one of the things they're going to immediately treat you with in an acute anything situation is three things typically: a painkiller of some sort, a muscle relaxer, and an anti-inflammatory. There's no difference in the herbal world that we would like to see, right? So a lot of times, if you're not into, let's say you don't want to take the medication type situation, that's where herbals come. Now, the biggest difference in herbal is, one, sometimes it takes more than just like a one little pill. Okay. So the medications are built so powerfully nowadays that a lot of times you don't need much, of this medication to get an actual result. In herbals, however, because it's natural, a lot of times you got to take more of it to get that desired result, or it doesn't last as long in the acute situation. Okay. So just understand that going in. But the biggest thing about being able to use herbals is you stay in an awareness position where you're still self-aware. Okay. Some of these painkillers out there and the anti-inflammatories are so powerful, your body loses its self-awareness. And so let's say you hurt a disc severely. And for whatever reason, you got in and you got a really strong painkiller. Okay. So that painkiller goes in and it's so powerful that you don't even know you heard it the day before. The problem is your body still knows it needs that healing time. And that's a critical point where you could actually heal up correctly. Instead, your body is in a sense tricked into saying, "Hey, there isn't any injury back there, so go ahead, don't do a lot." Or I mean, you go ahead and do your normal stuff. So then that person goes out again, gets injured even further, right? So we have to always understand when our body's responding in this inflamed way, right? There's a reason we have to get it down just as it came, right? So we want to be as after every injury, our goal should always be better than when we left it, right? That's how we do it with our kids. You go to a restaurant, you're at the table cleaner than when you left it, right? So those are things that I want our holistic to think about. It's hard to do when you have a painkiller or something so powerful that you can't feel where your body's at. So that self-awareness is critical. So that's why switching to this herbal idea is a really good idea, for your acute injury. So what we've done at the office, which I'm really pumped about, is we made little packages. So this one we're going to go over is basically the acute injury starter pack. So let's say somebody comes into the office and they want to go down that way, this is what we'll give them. So that's what I want to go over tonight. And then if we have any questions, we can do it. So the first is for the painkiller. Okay, so the painkiller that I really find effective for myself, and I'll give you a little story on this, is white willow bark. White willow bark is essentially aspirin in the herbal form. We use this one called Salazane. It's one from oh shoot, I can't remember the company, but that company they're really cool. That this supplement helps me a ton. So I had when we were first starting practice, when it was my office manager of 20 years, Rachel, she was just having babies, and myself, and so we were going, and of course that's when you get the most horrific sciatic nerve pain you've ever had in your life. And in between patients, I was like laying on a table, right? So I had to adjust somebody, lay down. It was bad until I started understanding how white willow bark worked as an herb. Because I was adamant I could make it through, getting getting adjusted, doing all those kind of things. What happened is I figured out on white willow bark is one of these where how you hear people taking 2 aspirins a day, those type of situations. This you could do 10 of them a day, and it really, really helps. It doesn't add, like with 2 aspirin a day, that typically are these little tiny pills, and then you 24 hours or 12-hour relief, or those kind of things. White willow bark doesn't exactly do that. It'd probably be 3 to 4 hours per time. So what I would do in an acute situation was I would put about 12 of them in my pocket. And so as the day goes on, as I felt it start to wear off a little bit, I was able to take 2 more, right? And then that way you're not like your brain is still registering that pain, but at the same time you're punching through pretty good. Like and for me, my sciatic nerve was intense, and it was one of those things that this stuff got me through. And I didn't even have the other stuff that we're about to show you either. At the time, my knowledge was not as good. So I would have done that plus this other stuff. The second is the Herbalist muscle relaxer. Now there's a few of these out there. Lot of good ideas for this. In fact, like Amy in the massage world, I'm almost thinking recommended it to are the people that are getting a massage because it's that good. But um, the next one is chamomile. So chamomile is a really, as a tincture, it's a super powerful everything. So it's this huge one that not a lot of people think about. Super easy on the gut, like why little tiny kids can have it. It's amazing, amazing one. There's a lot in the muscle relaxer category. Hops is another good one. Valerian root you hear about. So those are all good. But what I found is chamomile, if you're going to relax your muscles, you might as well also, do, have some kind of all the other stuff as well, right? So it's also a great antispasmodic, which allows you to, like the muscles kind of relax, anti-inflammatory, antimicrobial. It's a bitter, it's a carminative, which is the breaking down of fats, and menagogue, which is good for menstrual cycles, and a nervine. A nervine's what balances out the nerves. So if the nerves are firing in a painful situation, it can calm that down. So just remember that in chamomile, and that's in our little pack that we're going to do as a starter pack. So that's pretty cool. All right. This one's going to be a little, if Teresa Beach is watching, then we're going to switch this one up a little bit. I found some new stuff. This was turmeric. However, this is much, much better. I found some good stuff. Devil's Claw. Devil's Claw is a super powerful anti-inflammatory for the musculoskeletal system. There are a few out there. Devil's Claw is a really, really good one. So that is a good one as a tincture. And a lot of times it can be huge for you, as you go forward. And in the pain realm, you probably need that, right? So we've already done the painkiller, the muscle relaxer, and the anti-inflammatory with the Devil's Claw. Okay. So that's where we're at with those. And then a topical cream, there's a lot of good topical creams out there. The one we are going to use for our little starter pack is called Emu Cream. That's really good, but you can't discount Arnica, BioFreeze. There's a lot of good ones out there. But it's really important to have that on those because of the movement. So let's say you hurt your low back, right? And if you don't want to touch it, it's a good idea to kind of get some kind of hand movement, going into those joints. It helps a ton to kind of like help, tell your body, hey, this is a focal point. Like the little massages in there. A cream can help that quite a bit, especially in an acute situation like that. And then there's a lot other ones. There's a lot of other herbals out in each category, but having these as like in your medicine cabinet, in your holistic cabinet now. So you would have this holistic cabinet that you can just run to if anything happens within your family. So to me, these are very good. You don't have to worry about much. You can track that acute injury very well, and go from there. All right. All right. So it's kind of a shorter night on this stuff. So we got some things for questions, but what are we going to do for our 1% tribe improvement? Is get these herbals in your house. So make sure you have them, right? So you got to have an anti-inflammatory, a muscle relaxer, a painkiller, right? And there's lots of different options, right? You don't have to go with just what I was saying, and have them available because acute injuries are typically the ones that nail you pretty good. So, and those are the ones that get you going, oh dear, what do I do now? And this is where your holistic life, your holistic journey could be thrown off a little bit if you're like, hey, I'm not going to do no meds, right? But all of a sudden, an acute injury happens. What do you do then, right? So that's where being prepared is good. Ice packs, get some stinking ice packs for your home. That is crazy. But being a chiropractor, we know. So we had we had like 4 or 5 ice packs. I know. Just take to replace the ice cream, put that away, and then stick some ice packs in there. So that's how it is. Depends on what ice cream it is. No, I'm just kidding. All right. So that is all I have for tonight, actually.
Awesome.
Yeah. So I know. Do you have any questions, Amy?
I do not.
No. I was going it should be pretty cool. Like as you get your holistic medicine cabinet ready, it's going to be fun. The spring is coming. We're going to have Rachel has started a bunch of medicinal herbs. We're going to have some stuff. So that'll be great.
Awesome. Yeah.
Yeah. So I'm going to go if she'd like to, if you have any questions. Julie, you have any questions for us?
Yes,
Yes, fire away.
the white willow bark. Is that something that we could purchase as an herb somewhere? And
Good
then
question.
do you drink it as a tea? What I like to do is, put it in water, warm it up, put my washcloth in, and then put it over, maybe that painful area. Because I keep hearing about white willow bark, but I don't know what to do with it. I could research it too. I just thought of the question though.
No, that's good. I'm going to look up a place I really, really like. I want to see if they have it. I want to see it. There's this one I really, really like. They're called to get the like if you want just the whole like if you want a whole bag of those kind of things. So it's called Mountain Rose Herbs. Right. Yes. So you can get it as a powder or the bark. Um the one that we're carrying at the office now is a tincture, a supplement. You can get it as a tincture though. So that's another good way to take it in. But they end up with some really cool. Yeah, you can get it as a powder. You and make it as a tea. So that is really cool. I'm gonna have to go get that actually, now that I see that. So
Yeah,
so that's a great question.
yeah, same with the chamomile. I grow that so I can dry
Correct.
it, which I have it dried, and then make a tea and, drink it. Well, let's say I had a crazy day in the garden and now I'm kind of in pain because I did too much. The
Yep.
chamomile sounds like a good tea to drink after a hard day outside work and just to relax.
Exactly. And chamomile is so good. Let's say a hard day and you are done at the end of the thing. Rachel and myself were outside all day. So it's one of those where your joints start aching a little bit once you've chilled for the night. That's a good one. So think that way, right? So if it's not a crazy physical day, maybe you could try a different one. But chamomile, white willow bark. What's cool is, and I haven't done the research, Julie, but me and you could. We want to figure out, I think white willow bark, I think it's a shrub that it actually grows well here. So I got to figure that out because that's one of my big ones. Like if it grows in Michigan, we're kind of at an advantage. Like Southern Michigan, because of our winters not being too crazy, we have a big selection of herbs that we can actually do. And so I'm pretty excited about that portion. So, like, especially white willow bark. To me, like, it's aspirin. In the amount of times you hear, it's so sad because we went from, an aspirin a day keeps the doctor away. Oops, it's causing dialysis. Stop doing that. We got to quit making those mistakes. Like in a society, you're like, oh crap. Like you got to, and I'm telling you now, if you have never had any kidney issues, the first thing that's petrifying is I'll have a patient come in, you go, I'm on dialysis, and my doctor says I can't do, or I got, 10% left in my kidney, and so I can't do any aspirins or anything. Well, that tells you everything you need to know right there. So So that's the thing, like these ones, especially in the acute situation, because that's what throws us off. Our game is a holistic game's easy until it gets hard, right? Until it gets like it hits you in the face. And so holistically, hopefully, this acute one tonight will give people those little tools, to get it rolling. So
Yes,
you got
I
any
will
other ones?
also, I'll
Oh, go ahead.
find out about the willow, because we do have willow trees, but
Right.
what do they mean by white willow? So I'll have to do some research on that myself. I'll get back with you because I do know who would know this.
Right.
I know lots of horticulture people, so I have
And
lots
for
of
those
ways to get the answer.
I know. For those watching, you're going to hear me ask Julie some questions back at her because she's a horticulturist. And so it helps a ton. She works deep into the plant world for a long time. So it's kind of cool. We can throw stuff at her and we can see if it's actually possible. Because I know echinacea. I know echinacea because it's this beautiful purple plant that Rachel, started growing on the side of the house. And I'm like, oh, smokes. You could just replace all your flowers with beautiful things. Well, I'm not going to replace my tulips, even though you can't do that. Those tulips popped. Whoa. So that's cool.
Yeah,
If you're
as
in
long as you don't
Michigan,
have deer eating them.
right, exactly.
Yeah, deer love the tulips, so I have to grow daffodils, and they're
Oh, yeah,
out and they're beautiful too.
I
So
know it's getting close. My daughter's getting done with college and she really wants to. I was go up to the Tulip Festival again. Um, there's that one farm there that's just worth the drive. It's stunning. Acres of them. It's crazy. Just bring your wallet because you will buy a bunch of stuff you shouldn't. So just be ready for that. So, but yeah, well, thank you guys for tonight. I appreciate it. And I know it was a little quick tonight, but I hope these go good. Like each one, the acute injury one is going to be a little quicker, right? We kind of understand how to do those things. We're going to go into some deep dives in some other ones and we're going to go after it. And the next time we do this, so we're going to do movements for acute injury, mental health, right? So like some positive aspects there. And then in a few weeks from there, we'll start going into arthritis, like chronic like those kind of things, chronic pain, though those it'll be a little deeper each time, but I think these focused ones will help a lot of people out, so that'll be good. So all
good,
right. Well, if you guys are
sounds
good,
good.
all right. You guys have a good night. Enjoy it.
You.
Yeah.
Bye.
Bye.
Bye bye.
Bye.